In terms of nutrition, it's crucial to prepare our bodies for the surgical process. One of the things we aim to do with nutrition prehabilitation is eat enough energy, protein, and essential micronutrients so that we're building up reserves, and those reserves act as a buffer for us so that when we go to surgery, our body is better equipped to deal with the surgical insult or the stress of that procedure. In terms of a well-balanced diet, what we're aiming to do is make sure you have key nutrients come in before surgery so that you have those building blocks to help your immune system, which helps you kind of manage any infections during your surgical stay. It also helps in terms of wound healing, and it helps prevent unintentional weight loss. We also want to prevent any malnutrition during this time. Initially, we do a face-to-face assessment. We run through what the clinical picture looks like, when the surgical date is proposed to be, and then we come up with an action plan in terms of how we can best support that patient, look at the diet that they're already eating, and work out how we can modify the diet to meet their energy, protein, and key nutrients to build up those reserves before their surgical date. When we see a patient, we'll assess their weight, their height, their BMI. What we're aiming to do is keep their weight as stable as possible before surgery, unless recommended otherwise by their surgical team. And the goal around that is we want to focus on building muscle and building up their stores before that surgical procedure. If you talk to your surgical team, they'll be able to talk you through whether you're eligible for our service and refer you into our service.